I wish to acknowledge the Duck and Jung people as the traditional custodians of the land on which I work. I pay my respects to the elders past and present and recognise the continuing connection and contribution to the land. Welcome back to Matter of Vax. I'm Steph O'Connell. Today we're going to talk about respiratory syncytial virus, RSV, which is a highly infectious virus responsible for more hospitalisations for children than any other disease. But RSV, let's not be fooled, it affects people of all ages. Dr. Nusrat Homaira is a paediatric respiratory epidemiologist based at the University of New South Wales and Sydney Children's Hospital. Nusrat's research focuses on respiratory syncytial virus. Let's welcome Nusrat.
Good morning, Steph, and thanks for having me today on this lovely Saturday morning. So, as you say, respiratory syncytial virus, or more popularly known as RSV, it is a virus of childhood. It is probably the leading virus of childhood, and we have now known this for decades, which what it means is that all children, almost 80 to 90% of children, will get infected by this virus before their second birthday. And the first infection that they get, which is often in the first 6 months of their life, can be quite severe, meaning it's severe enough for them to rock up into our EDs and be hospitalized and transferred into the intensive care unit. The first infection is generally the most severe ones. Later on, as they grow up, they still get reinfected, but the subsequent infections are not that severe. So because it's a virus of childhood and it really infects children when they're very little, when their immune system is not as developed as it should be, that's why this virus is probably the most serious virus of childhood.
A lot of people understandably get it a bit confused with the flu.
Yes.
But it's a very serious virus.
Exactly. So influenza or flu is also a very serious virus. And, influenza is also like RSV, a seasonal virus. So during winter months, we get peaks of influenza. And the thing is, the severity of influenza can vary from year to year. What is the difference between influenza and RSV is more children get infected with RSV in the first 2 years of life compared to influenza. RSV also infects people in the elderly age group, but influenza can be severe at any age group. But when we look at the children population or the infants, RSV clearly has much more severe impact compared to influenza.
We talk about children getting RSV, but of course, adults around children are also vulnerable.
Yes, absolutely, Steph. And there's now more and more data coming out suggesting that RSV is an equally important virus in the elderly age group, especially in the 65 plus age group. And what it means is for our grandparents, because often grandparents take care of the babies and the children when parents are working, they're equally at risk of picking up the infection from the children. And if they have already some underlying chronic condition that puts them at risk of picking up this infection, say, for example, heart condition or, existing lung conditions like chronic obstructive pulmonary disease, or they have, they have some renal condition where they need dialysis or immune suppression. Those things put them at higher risk. So then our elderly population already at risk, if they pick up RSV from the younger babies or from the infants, they are at risk of developing severe disease. And we now see it's equally important in that population as well.
It's a dangerous virus, isn't it?
It is.
If this is such a dangerous virus, particularly in babies, how do we recognize it?
Yeah, so that's a very important question. And this is probably one of the most commonly asked questions by parents. How do I know my baby is sick enough? So, RSV is like any other respiratory infection. So oftentimes, not oftentimes, it's always a self-limiting disease. So in majority of the cases, babies will develop mild symptoms like, runny nose, a little bit of cough, but oftentimes around 1/3 of them, 30% of them will then go on to develop more severe disease. And so how do you recognize that severe disease? It's often characterized by cough, wheezy chest. So the babies will have, whistle-like noises in the chest, and they will have fever, and they will be lethargic. They will have they will not want to drink or feed because of the lethargy. They can also develop cyanosis, so lack of oxygen, and so discoloration of the skin, often bluish and purplish discoloration. And one of the key
Mm.
symptoms that we see parents telling us is that they will come and tell you that my baby didn't breathe or hold his their breath for fraction of seconds, which is called apnea. And that's really a key symptom when you know that it is going to be a severe sort of prognosis for the baby. So really, if the baby has fever, is not feeding well, is lethargic, has a wheezy chest, or has difficulty in breathing, you should definitely go to your primary care provider or to your nearest hospital.
And this must be putting a huge burden on our health system.
Exactly, Steph. Like I said, all babies by their second birthday will get the infection. And oftentimes, the first infection, which is in the first 6 months of their life, can be quite severe, for which they need to come to the hospital. And when babies get sick, we obviously get much more worried because they're so small. So every winter during the RSV season, we see a huge influx into the hospitals. Across Australia, there's almost 6,000 hospital admissions every year for this particular virus in the first 2 years of their lives. And this is a gross underestimation because, testing patterns and testing for RSV was very varied pre-COVID. So we really don't know the exact burden, but you can understand there's around 6,000 hospital admissions. And we don't even know how many actually go to the primary care settings, to the GPs, because the bulk of the burden is actually in the primary care setting, but we don't know what's going on there. So clearly, yeah, the health system every year during winter season, it's overstretched because of bronchiolitis admission in infants due to RSV.
So, comparing that to influenza, a few years ago, before we started hearing about RSV, did we confuse RSV with the flu?
I would like to shy away from comparing these two viruses because these two viruses mean different things. And I don't want to put the highlight on one virus and take away the highlight from another one. Both these viruses are very bad viruses. With flu, I think
Mm.
there was a little bit of benefit or advantage. And that's why probably we also talked more, was because, there is a vaccine available for flu, right? So there is a seasonal
Mm.
vaccine
Yeah.
available for flu, and it is recommended for the elderly population. It's recommended for pregnant women during pregnancy. It's recommended for children as well
Yeah.
beyond the 6 months of age.
Mm.
Unfortunately for RSV, up until 2022, we didn't have any preventative strategies. We just had one
Yeah.
monoclonal antibody, which was palivizumab or Synagis, which was only recommended for high risk babies, right? So babies who had underlying
Mm.
chronic condition or were born with congenital heart and lung diseases or were born preterm. So that's why, I think there was more sort of attention towards flu because we have this vaccine.
Yeah.
So if we talk
It
more,
was
we can create
preventable.
awareness and people would take the vaccine. But now it's a very exciting time for many of us. We are in a situation where we have at least two preventative therapeutics or immunoprophylaxis for babies against RSV and one vaccine for elderly population to prevent against severe RSV disease. So hence there's again a heightened attention so that people get to know about all these things. But we have known for decades now that RSV is the leading virus of childhood. But I don't want to compare those two viruses because I don't want to be in a situation where I make one virus important and the other less important.
Yeah. The fact that we are in a really exciting time is probably why we're chatting right now. This year, we've had some pretty big announcements about RSV being preventable with vaccination. Can you tell us where we're up to right now with that?
Yeah, so there's already an adult vaccine that's approved and for use in the elderly population. And for infants, there's two immunoprophylaxis that's being used in clinical settings in multiple countries. So US, UK, Canada, some parts of Europe, and potentially Australia also from this winter that we'll be using it. So for babies, the two preventative therapeutics or immunoprophylaxis that we have is a monoclonal antibody. So it's a long acting monoclonal antibody that is supposed to be given to babies after they're born, and that is supposed to protect them against severe RSV disease in the first 6 months of their lives when they're at highest risk, for use in all babies in Western Australia and in Queensland and in New South Wales for eligible infants. So there is a criteria for New South Wales which baby will get it. These are really the high risk babies, okay? And including Aboriginal ones as well. But for Western Australia and Queensland, it's for all babies. And the other one is a maternal vaccine. Maternal vaccines are very good public health interventions. We have maternal vaccine for influenza, we have for pertussis, and we know they work. And so oftentimes what happens is, babies in their first 6 months of their lives, because of their inadequately developed immune system, they're not ready for majority of the vaccines. So we vaccinate the pregnant women so that it protects the pregnant women during pregnancy, but also leads to enhanced antibody in the babies through placenta that then protects them in the first 6 months of their lives. Now we have a maternal vaccine against RSV. So there's two things which are potentially going to prevent severe RSV disease, which means medically attended RSV disease, the need to go to hospitals or emergency department for RSV. And there's some data coming out from places where it's being used, and also from the clinical trial data, what it suggests that if these products, if these prophylactics are doing what they're supposed to do, then we can actually see 60 to 80% reduction in these hospital admissions. And I
Wow.
can't imagine being in a pediatric ward where we don't see bronchiolitis anymore. That, to me, as a child health researcher, is the biggest thing that I
Is
will
wonderful.
probably witness,
Yeah.
and I can't tell
Yeah,
you
that's
how
great.
exciting that is for us who have been working in this field for 2 decades now.
Yeah, it really is.
So those are the ones that we have for RSV. However, I also want to highlight that there's that group, 6 months to 2 years, that still need that protection, because the immunoprophylactics that we have right now, or the passive immunizations, are going to protect the first 6 months of their lives, and which is perfect because that's when they're at highest risk. But they're also at risk beyond that period. And I think we need to also now think about that. There are vaccines under trial for toddlers, and hopefully we will be in a situation when that becomes available as well. And the other thing is, these are preventative therapeutics. So they're supposed to prevent severe disease, but we still don't have an effective treatment. So some children will still get the virus and will still get severely ill. So we need to think about effective treatment as well for them.
And what about older Australians? Recently, there was an announcement that the vaccine is available for people over 60 years of age. It's privately available, I need to just mention. It's not on the National Immunisation Program, and you will have to speak to your healthcare provider about accessing the vaccine, but well worthwhile.
Yes, I think it's absolutely worthwhile. Again, some of the decisions are policy relevant decisions, and I can't make those decisions. These are the federal government,
No.
and state based decisions. But I absolutely think that, we should make these vaccines included in the immunization program, NIP. They shouldn't be privately
I
available,
agree.
because we can't put the onus on the patients to take the vaccine. And Australia is a wealthy country. We should be able to afford these vaccines for people who need it. The primary care providers, your specific primary care provider, can do risk stratification and decide on who needs the vaccine and who doesn't, just like we did for COVID vaccine. And it should be
Yes.
made available. It shouldn't be a privately funded vaccine. But then again, I'm not in a situation to make those decisions. I think these are the decisions made by the federal and state government.
Yeah, I was also reading yesterday that while it's privately available for people over 60 years of age, that for those whom it's recommended for, it's a little difficult to get at the moment. But that's kind of standard, isn't it? For most new vaccines, they can be a little hard to access.
Yeah, I think that we are still in Australia, we have supply issues around those vaccines. But again, I'm not too pessimist about that. This is the first year, and I think as time goes on, globally, as the uptake improves, there's going to be more sort of demand issue on the pharmaceuticals, and of course the production will have to improve. I think as time goes by, we are going to get around those issues. We had the same issue with COVID vaccine when it first became available.
Yeah.
So health is one of the biggest commodity. I don't want to put it that way, but it is. And it's a consumer
It
driven
is.
market, So as we build up those pressure, as more people are wanting to take the vaccine, I think we are going to see a shift in the market, and there's going to be more vaccines made available.
I imagine getting a diagnosis of RSV for many people has been a pretty scary thing. I want to thank you for giving us all of this key information, and it's such good news to be talking to you this year when vaccines for people over 60 have been announced and some prevention is out there finally.
Thank you, Steph. It was lovely talking to you about a virus that's very close to my heart.
We love talking to people who are passionate about disease prevention. Thanks very much for joining us.
Thank you.
You've been listening to Matter of Vax. You can hear more podcasts on this subject matter and see the video at www.ifa.org.au. and hear more Matter of Vax wherever you listen to your podcasts.